Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, in the patient suffering from galactosemia, there is a type of cataract called as oil droplet cataract. Okay, there is two things. Galactosemia can occur due to two enzyme deficiencies. One, it is galactose-uridyl transferase deficiency can lead to galactosemia. Similarly, even the deficiency of the galactokinase will also result in galactosemic cataract. So, deficiency in galactose-uridyl transferase will result in oil droplet cataract, whereas deficiency of galactokinase will result in lamellar cataract. So, galactosemic cataract will look something like this because it is an oil droplet cataract.
thank you and thank you for watching.